My name is Rahul Manchanda, and what I do is I'm a gynecologist and an obstetrician. But what I actually do is gynecological surgery and gynecological surgery through minimally invasive techniques. So I'm what we call a gynecological endoscopic surgeon. So I'm qualified to do a gynecology and obstetrics, which is delivery of babies as well. So that's what I do. You're correct that there are lots of women in this field, but they're predominantly in what I would call Delhi or maybe even a little bit North India. But otherwise, if you look world over and also in India, whether it's Calcutta, Bombay, Madras, abroad, a lot of the gynecologists are men. But aside that, how did I get into it is my mother's a gynecologist. So yes, there is definitely, when your parents are in a field, you get influenced. And mum was in this field, she doesn't practice anymore, so you get influenced. But how I actually got into it, because it's probably one of the most complete subjects that I found during my tenure in my basic MBBS. Because if you look at there's surgery, which is what I do, there's deliveries, the baby, you have the neonatology aspect, which is the babies come out and you manage them. You have even the community health aspect of looking into whether it's the vaccinations or it's looking at prevention of cancer cervix, women's health. So there's a lot to do with community aspects, surgery, babies, and then of course when you're dealing with women, I'm sure anybody and everybody on earth would say that, and this is with due apologies to all the men there, are much better and nicer to deal with. So, and I come from, this is again a little funny, should I say, unusual. I come from what is called female-centric or a matriarchal family. My mother's divorced, so I had one parent, which is my mother. I have two daughters. I have my wife, of course, and all the staff in the house are women. So I am completely outnumbered, and I'm from a matriarchal. Though I believe that all families are matriarchal, whether we accept it or not. There's a funny thing again, if I may say this, and I keep talking, but there's a movie. If you've seen My Big Fat Greek Wedding, I don't know if you've seen it, and it is so telling that this woman who's the mother, and she's talking to her daughter who wants to get out, go out and do like you people are young, go out and do whatever she wants to become and go out into the world and go to college and all. And the mother and the father doesn't want her to do that. He wants her to get married and all. So the mother talks to her and says, "Bro, while he's the head of the family, I'm the neck of the family, so I know how to manage and how to move the head where I want to." So that's actually what happens in all families. It's just that we don't believe it, we don't understand that. But the woman is the cog in the wheel, is the most important part of the family and the family. So that's how I got into, to cut a long story short, that's how I was influenced from all over, and I thought this is the best field to get into. Oh, completely supportive. I'm sure they're worried. I'm worried, but the point is, supportive, yes. Like I said, women, I told you the story of my big fat Greek wedding. Women are generally very supportive, and my family is no, exception to that. Very supportive. Nobody says anything. I'm sure they have it in their minds. But you carry on, you have to work. There's no question about it. To 25 years. I joined my post-graduation in 1996, which means then it's been gynecology. So 1996 happened. That it really depends on the individual. It's not male and female, it's the person, the individual, as to how sensitive or empathetic they are to your problem. So, and once the woman knows, the second thing, knows that you're there to look after them, you're there to take care of them, they have the confidence in you. I always tell, I just need one meeting, one talk with my patient, and by and large, then they will not leave you. So they need to have that confidence, and that's with anybody, be it man or woman. So that's important. I would it's been enriching and a great journey, and I'm looking forward to the rest of it. If you're looking at deliveries only, then very few deliveries, like you said, need expert intervention. But why do we do it? Why do we go and why do we meet our doctors once a year? Well, we should meet our doctors once a year. Because we know of the problems that can happen and we want to take, we're looking at preventive medicine. Why do we do yoga? We do it to keep healthy. Similarly, going to a doctor is more for prevention. You know 10 things can happen during a delivery. You want to be as certain as possible that they don't happen during your delivery. So you go to that and you meet the doctor and you take all precautions you have to be that. But coming back to what your grandmother said, it's very true. In the villages, even now, most deliveries are not over sort of viewed or over looked by doctors by definitely not by gynecologists. It's been done by the diet and those dyes or the antenatal workers are better than what they used to be before. ज़माने बिल्कुल नहीं होता था कुछ. Now you have them with the hemoglobin kits. They check your hemoglobin. They know that just by getting your hemoglobin up, you can avoid many problems. So yes, as we go on, as things develop, things are going to be, going to change. But if we get into a rut, we definitely will become a little mechanical. And to an extent, all our lives have become. हम सुबह जाते हैं काम के लिए, फिर आ जाते हैं वापस. What this thing has taught us, this pandemic has taught us, is to, or some of us, like I was talking to you, is that not to be so resting, to actually go, all those things that come up, sit and have your coffee and smell the coffee and say, how lovely. वो वाताज जो होता था, जो हमारे ज़माने में होता था, जो ऐड होता था, वो sorry, I come back to that again, but it is actually what you should do. You realize what is really important. But it's true, we straitjacket ourselves. We know doctors have to be like this. I'll give you a funny story. When I came into practice, which was 2000, after finishing my MD, my post-graduation from 1996 to 1999, then came into practice. I looked much younger. I didn't have a pot belly. अब थोड़ा सा है. I didn't have white hair. So I was not a doctor. लोग मुझे देख के बोलते थे कि कौन बच्चे के पास भेज दिया. I actually got, why the funny story is, I actually got, now I have glasses. I actually got glasses made so that I looked the part, and I had them made, and I still have few photographs of those that I used to wear. I went and I did the whole spiel of finding out how to get my hair colored white, which people advised me against. So we straitjacket ourselves into certain things, which we should not. But having said that, the other extreme is is for a doctor to be going to work in shorts. Now you wouldn't go, however emancipated you are, you don't want your gynecologist to be coming in to examine you in a pair of heads and shorts. At least I would. I must be honest. So, whereas abroad, I've seen people going to work in shorts also. So, there has to be some sort of a healthy medium. But we straitjacket ourselves and we become more mechanical in that role. But that's what makes us, people who are not so, push the boundaries, become different, and we need to adjust with changing times.